Assalamu alaikum and welcome to the show Mindful Matters on Radio Al Ansar at 90.4 FM in Durban and 105.6 FM in Pietermaritzburg. A show that you should know by now promises to provide an hour of inspiration, information and motivation with me, your host, Nazia Iram Osman. Please feel free to participate in the show and make it interactive so we can learn and inspire each other by sharing our stories. Please WhatsApp your questions, queries, feedback, comments. The WhatsApp number is 060 904 1056. I'm looking forward to hearing from you soon. So the topic we're going to be speaking about today is how alternative medicine can help with symptoms of anxiety and depression. Now, being a clinical psychologist, let me put a huge disclaimer first. And that is, if any of you have already been diagnosed with a medical condition and are on medication, please do not leave it. And if you decide you want to try any alternatives, please check with your treating medical practitioner first. So keeping that in mind, most of the patients I see in a normal working day will be experiencing some symptoms of depression or anxiety. In a study conducted in 2018, it was found that 1 in every 6 South Africans will suffer from depression and or anxiety. Too many people still think that depression is all in the mind, and there's such guilt to the sufferers because people keep on telling them snap out of it. As well as clinical depression, where symptoms are severe enough to affect day-to-day functioning, some of my patients will have depressive symptoms but still continue to work and not have serious problems. This situation is referred to as a mild depression. And this is probably the largest group of patients that I see in my practice every day. People come with a variety of complaints, including a feeling of persistent fatigue, that is tiredness, lack of appetite or excess appetite, resulting in comfort eating, which we spoke about last week. I hope you were listening. Not being able to look forward to enjoyable events such as holidays or family celebrations, poor sleep, feeling of anxiety and low self-esteem. And they feel guilty for just not feeling well. So feeling of not coping, lack of interest in activities and relationships, and generally feeling cut off from the world. So while most of us can experience these feelings at some time to another to a greater or lesser extent, it is when this lasts for weeks on end that we really start feeling out of balance. And in these circumstances, the body starts to need a little help to recover. So in the past, people with symptoms of depression or anxiety were often treated with tranquilizers or benzodiazepines like diazepam, Rivotril or Valium. This is because depression is really a mixture of feeling low combined with symptoms of anxiety, or common word, worry. And they both affect the same part of the brain and neurotransmitters, namely serotonin. Anxiety can range from waking up with a sinking feeling or butterflies in the stomach or panic attacks to a full-blown physical symptoms of acid indigestion, problem with swallowing, diarrhea, a feeling of tightness in the throat, difficulty breathing, weight loss, or a feeling that something is wrong with me or I will die. Although tranquilizers may still be used by the medical profession, if symptoms of anxiety are very severe, they are now generally recommended only for a short-term use, that is up to 2 weeks at a time, due to their addictive nature. The most common medication for depression and severe anxiety these days are antidepressants, which help to rebalance the mood hormones. Commonly, the SSRIs, and less often, the tricyclic antidepressants. A common one is amitriptyline. However, their effectiveness in mild or subthreshold symptoms is questioned by modern research, and they now are not routinely advised. Herbal treatments also work in a similar way to conventional antidepressants, although usually with a lower rate of side effects. They often have a combination of active ingredients as opposed to the synthetic medications, which are single substances in a potentially more potent form. However, it's critical that even these natural ones that we consider must have had some lab tests or studies to prove their efficacy. A proven method is homeopathy as an alternative to modern medicine, and it's known to treat the whole person and not just the body. So I finished rattle on, oh my word. To tell us more about this, we have with us Homeopath, Dr. Fatima Hansa. Welcome, Fatima, to Mindful Matters, and thank you for making time today.
Thank you, Nazia. Assalamu alaikum.
Yeah, thank you. Thank you for being here. Please tell us a little bit more about you, who you are, and the work that you do.
Okay, I'm a homeopathic practitioner. I practice in Musgrave. This is my 8th year in practice.
Right.
I qualified at DUT with a master's in homeopathy. Thesis research topic was on menopause. I find in practice most of my patients are pediatrics, but also a lot of women, and I would say 50% of the cases are anxiety or depressive related cases. So I'm quite excited that it's such a trending topic that we're speaking about today, and I can't wait to share with you tips that are hopefully going to help you move past this phase in your life.
Okay. Thank you for that. And, I'm just trying to create a correlation. I don't know if one is there. You said you see a lot of women, and you said most of 50% of your practice is anxiety and depression. Did I get that right?
Yes.
Okay, so now here's the correlation. Do you think more women suffer from these conditions? And I see you smiling at that one.
Well, maybe because I'm biased, and I feel like women take on a lot when it comes to workload and just have that feeling of being overwhelmed with so much to do. But I think it's definitely fair amongst men and women that
genders.
both equally have symptoms of depression and anxiety. But I find that maybe the different sexes display it in different ways. I find men sort of kind of tend to bottle it in a lot more, and women, once you open that tap, the information just flows after that.
Pours out. I hear you. So I think the help-seeking behavior of men is slightly different. Women like to talk more and reach out.
Yes, I don't want to generalize, but mostly, men wait until it's a life and death situation for them to finally crack and say, okay, now I need help.
Oh, okay. So the men out there, if you don't agree, please WhatsApp us and let us know. Okay. So I did some background on homeopathy from Dr. Google, say this very respectfully. But I'm sure you can add to that to help us better understand how homeopathy views mental illness and or well-being.
Well, homeopathy in general is a holistic form. It's a holistic form of medicine, and we follow the principles of likes cures like, whereas if something, a substance in its crude form can cause symptoms, the same substance in a much more diluted form can help heal those same signs and symptoms. So we are holistic. It's a very individual approach, and I like to leave the mental symptoms for the end of the consult. So I go through all the physical, and definitely the mental plays a major role, and we'll discuss more about that as we go on, about how we get to the bottom of how it's correlating with the physical symptoms as well. So you cannot isolate apart and say, okay, we're just going to treat your psoriasis now. Let's forget about your mood and your mental symptoms. That's not important. It doesn't work like that. We need to take the patient, their entire being into account. So mental symptoms, physical symptoms, all of it, to then try and decipher which remedy, which herb, what treatment protocol is best for them.
Okay, so I think you're taking into account the body, mind and soul, the
Exactly.
whole person.
It's similar to when you have a cold and you feel, as much as you're sick physically, mentally you're not at your best at all. You're grumpy, you're moody, you don't want people to talk to you and ask you for things. The same way, if mentally you're not in a good place, physically you can have those manifestations that then develop in correlation with that same mindset.
Okay. And I heard you say we work on a principle of
likes cures likes.
Cure. Yeah. So what is that about?
So for example, the most common one that most people use, if you look at a red onion, which is called Allium cepa, that if you're cutting an onion, the symptoms that you are then experiencing in its raw form is your runny nose, burning eyes, watery eyes, that sort of typical sinusitis kind of symptoms, rhinitis. So the same remedy in a diluted homeopathic form is used to treat rhinitis, sinusitis, burning eyes, burning nose, sneezing, that sort of thing. So in that way, it's how your likes cures likes.
Okay. And so here's another, curious about this. So just say if I come in and our lovely technician, handsome technician Riaz comes in and we both have a cold, would we both get the same remedy? Or we both have sinusitis?
It's important to understand that there's two different classes of homeopaths. You get your classical homeopaths and then you get your clinical homeopaths. I'd like to think that I fall quite in the middle somewhere. In that if you're looking at clinical, then yes, we can give you the exact same things for your cold. Clinical remedies, herbs, tinctures that are then perfect for immune boosters and either your runny nose or your cough or your fever, that sort of thing. If you're looking at being more classical, then you're having a bit more of an in-depth conversation with the patient. You're taking into account their exact symptoms. Some people have a cold and their nose is always blocked. Some people have their cold and their nose is always runny. Some throw a high fever, some have a low-grade fever. Everyone presents differently. Everyone's immune system presents differently.
Right.
Like I see some kids who throw beautiful high
mucus?
fevers.
No.
Mucus is never beautiful, but I mean, everyone just reacts differently. So if you're looking at a more classical approach, yes, we'll go more individual. If a child is more clingy, more irritable, you're going to look at maybe some chamomilla or pulsatilla. If you're looking at a child that only gets chest infections, every time they get sick, it goes straight to the chest. How often I've heard this. And then you look at remedies like your phosphorus. So it really just depends on the patient and the practitioner, as to what their method is. Right. I do tend to bring in a lot of functional medicine into my practice. So I try and cover all my bases with supplementation as well as herbs, as well as the homeopathic remedies.
Okay, so by using the word functional medicine, I'm assuming that it's not just homeopathic remedies,
not
just
alternative
or other sort of.
Yes, so it's all still in the umbrella of your complementary alternative medicine, your CAMs, and still at the same time we're still trying to promote that gentle restoration of health, gentle healing, where we're not going to give you medication where you're going to have major side effects or feel unwell.
And I think that's a huge thing to take into account, that we're taking meds to feel better, but sometimes the side effects can be so dire and make you feel even worse.
Yeah, but also in the same breath, at the same time, we are living in an era of instant gratification, and it's sometimes difficult for those that have always just taken a pill and gotten better the next day to now cross over and say this may take a little longer. But also I must say it may or it may not. Some people respond very fast, and you sort of get your two types of patients, where you get your grasshoppers and your rhinos. So your grasshoppers, where the smallest remedy kind of does something, or they're very sensitive to, and you find, we're having a side effect, or this is happening and that is happening and I need to stop the remedy. And then you get your rhinos, where as much as you give them more and more and more, and nothing kind of shifts that therapeutic
so the reactive
margin.
People and the not so.
So it really just depends. It's just patient dependent, practitioner dependent, and you kind of just go along this journey and see hopefully that there is an improvement.
Okay. And for someone coming to a homeopath for the first time, because I think about psychology, the first session, people are so anxious. What are you going to ask me? What is this going to be about? So when a person comes to a homeopath, what should they expect? What kind of questions, what will it be like for them?
They can expect to bear all.
She doesn't mean that. I promise you.
No, look, when we come in, it's just it's usually an hour, the initial consultation, and that's so that we can get head to toe signs and symptoms that the person might be experiencing. And then so often they leave out things, so they expect to come in, okay, I'm just going in for my acne, we're going to talk about my skin, we might talk about my diet, and then they end up using boxes of tissues and saying, I don't think we were going to talk about this, or get to that. So it's all your physical symptoms, and I try and get in as much as mental symptoms. So where you're at right now in your life, what's going on, how are you doing, how are you coping?
Right. So is it more that the emotional issues can flare up into physical, or is it just when you're stressed everything gets worse? Which one do you think is more apt for homeopathy?
I think both. Okay. There's often there's your current situations that you're dealing with, and also there's so much baggage that people bring through their entire life. Right. And especially when you're looking at anxiety and depression, it stems from somewhere.
Right.
There's something that triggered
A
that
situation
cascade of
that could
responses to happen.
Right. And, I'm just wondering, how is homeopathy in terms of treating anxiety and depression similar to allopathic medicine? Or different? What are the similarities and differences?
Okay, similarities I think would be your diagnosis.
Okay.
So
that same diagnosis holds.
Yes, so your signs and your symptoms, as well as if you're looking at your blood tests, if you're looking now at the numbers, serotonin levels, vitamin D, B12, any other, maybe even IBS symptoms. So a lot of the signs and symptoms would be the same, diagnostic wise, but treatment definitely different. With your allopathic, you're looking at mostly replacive therapy, where you're trying to replace the person's neurotransmitters or to build it up. And with homeopathy, you're trying to trigger the body's response to bring you back into balance. So you're stimulating your own healing. So we're not saying at all that you're going to be on this forever. Not at all. We're trying to assist you to reach a certain state and just try and maintain from there on.
Okay. So if I had to bring it down to an example, like I think about depression, we know is caused by the lack of some depletion of serotonin and anxiety. How would homeopathy help with that? Because the SSRIs would help with the reabsorption, so we don't lose so much of it.
Right.
And homeopathy, would it also work with serotonin, or what?
Homeopathy specifically, I would do a lot of remedies depending on the person's mental state. So there's a whole lot of different remedies that we can choose from. There's so many, but it just depends on the type of person or the personality of the person. But with severe cases, I always add on herbal therapies. So specifically, you're looking at an umbrella of herbs that are called your adaptogens. Whereas if levels are low, it brings it up. Where levels are high, it brings it down. So there's quite a few amazing adaptogens that if you use good quality with high absorption, you're going to get that therapeutic effect of helping to build up serotonin levels.
Okay. Now, what do you think about, whenever you see natural remedies of depression, St. John's wort comes up, if that's how you pronounce it. What do you think about these ones? You just go to the pharmacy and you pick them up. Do you think they have a use to them? I'm talking about for depression.
The ones sold over the counter are not the strongest in concentration wise, so I'm not so concerned about side effects, although there are your contraindications, like not to use St. John's worts if you are already on antidepressants. But there's no harm in trying, and let's be honest, most people would rather shop off the counter than go to see a practitioner first, just trying to be more economical in that. But you need to also step into the mind of a consumer when you're standing there and you're thinking, okay, do I buy this 60 capsules of omega for 100 rand or 100 rand versus 120 capsules of an omega? And you have to look at it's difficult when you're not sure what you're looking for. And when it comes to herbs, when it comes to supplementation, you want that therapeutic effect. So I do try and only push towards the best quality where I know they have been clinically proven to work. And that's what brings your patients back to you, because they felt the change, they felt the difference being on alternative medicine.
Right. So you can guide them to make that decision and make sure they choose the right ones. And adaptogenics, what is that?
Okay, so if we look at the very popular ones out there, is your ashwagandha. How many of us have heard of that? Ashwagandha is beautiful.
Is that for stress?
So it's your stress adaptogen. If we let's look at just physiology first. I'm sure you know as well your HPA axis. So that's your hypothalamus, your pituitary gland, which is in your brain, and then your adrenal glands that sit on top of your kidneys. So your adrenal glands are in charge of your stress hormones, your adrenaline, your cortisol mainly. So each time your body goes into a stress mode, cortisol shoots out. And if you look at evolution, the cortisol, that stress response was meant to be for a life and death situation. There's a lion, I need to run. Shoot out the cortisol, get my blood pumping, get my heart pumping, get my
flight,
brain. Exactly. And now we're having such little triggers in life that are now setting off this response.
Right. It's been so interesting, and I think time just always seems to be flying. But we have to pause for an ad break, and we'll catch up with Fatima after this quick ad break. Assalamu alaikum, and welcome back to Mindful Matters, where we're having a nice chat with Dr. Fatima Hansa, the homeopath. Some messages have come through, and a brother named Mukhtar from Pietermaritzburg says he has very bad stress, and he's wondering whether the symptoms that he's experiencing is weakness and dizziness, and he's wondering whether this can be caused by stress. So, and the first thing that comes to my mind, Fatima, is if someone has anxiety, they can feel that they can't breathe, and the chest feels like it's closing off, and there can be dizziness and weakness in the knees. But I don't know if we should go straight to anxiety without having him medically checked up. I don't know. You, the homeopath, you help me with that one.
Just clinically speaking, if we're looking at anxiety or stress or even depression, it's still going to put forward the same stress response towards your adrenals. And then a lot of people that do experience like your panic attacks are going to experience that feeling of impending doom or dizziness, or I'm really unwell or uneasy. So I think it's difficult to diagnose and say what for sure could be causing dizziness and weakness. It could be glucose levels, it could be thyroid issues, but definitely stress plays an important
and can mimic these,
condition.
Okay.
It does exacerbate any condition.
Right.
So he needs to have probably a full consultation, maybe some blood tests, just to rule out any underlying causes.
Right. And he brings out a very relevant question. Can a general medical condition be mistaken for anxiety or depression? Or what are the common ones?
With mood changes and feelings of uneasiness, there are a lot of different conditions, like your thyroid hormone, for example. I think that's one of the first blood tests that any doctor would do to check that your thyroid is functioning properly. If it's underactive, you could be feeling your low mood, sense of depression, where everything is just low. And then if it's overactive, you could be having that feelings of anxiety, even IBS symptoms. So, especially with females and hormonal imbalances, there often is a link between feeling mentally unwell and having a hormonal imbalance.
Okay. And, I think we were talking about this during the break. What about people that take, the normal contraceptive pill? Can that affect mood?
The oral contraceptive pill is what we call an endocrine disruptor. So it's basically a pill that you're taking that's tricking your body into saying that you're pregnant now, so you're not going to ovulate. And it does cause inflammation as well.
Okay.
So I think, there's still so much research that needs to be done regarding this. And a lot of females, once they start the pill, can immediately identify with some signs and symptoms that were not there before.
Okay.
It might regulate your period, but the side effects that come along with that, I'm not sure if they're willing to pay that price.
True, yeah. And I think lots of medication, not just the pill, sometimes we start picking up weight and we're starting to feel a bit more sluggish, and that would make us feel less
sluggish,
weepiness, sad, tearful, and all the rest of it. And I know you mentioned that each treatment is tailored to the individual, but I'm just curious. Just look at if someone comes with depression, and you want to just guide them on what's the usual meds or nutrients or supplements that could help. Do you have like a checklist that says, okay, right, vitamin D, whatever? Do you have something?
I definitely have a whole list at the back of my mind, as much as I try not to to keep it out and try and just focus on the patient. I do have my go-tos that I love and that I know I always get good feedback with. Ashwagandha is one of the main ones that are easily attainable. And although I have to mention that you need to be taking this consistently.
Okay.
You need to be taking it every day, and say by week 3, by week 4, you then start to feel the full benefits of a herb or a supplement. Vitamin D, I use tremendously. I'm never without it. It's basically my bread and butter of practice for kids, for adults, for anyone with any chronic condition. Supportive care is always a vitamin D add-on. If you look at your cells, each cell in your body has receptors for thyroid hormone, and the other is vitamin D. And we know we don't even really call it a vitamin anymore. It's actually called a pro-hormone because it helps other hormones work inside your cell.
Right.
And 8 out of 10 times sending a patient for a vitamin D test,
They'll
it
have
comes
low
out
levels.
low. And I think whether it's just work life, being indoors all the time, not getting enough sunshine, although I must say there's a few cases where people actually work outdoors and their vitamin D levels are still low, then you look at your gut and the conversion of that into its active form of D3.
Right.
So, vitamin D is really important with your immune regulation, as well as for your mood, as a mood adaptogen. So it definitely helps with depression as well as anxiety. The other really underlooked supplement is your omega-3.
And
I think
that's a go-to for everything, or a lot of...
It's, your cardiovascular, your skin, your mental health. Omega-3 is wonderful. And, it's like I was speaking earlier about being a consumer. You don't know quality, quantity, that sort of thing. You need to look at a high dose, good quality if you're looking for therapeutic effects. If you're not just looking, I'm just going to add this on, but I don't really have any physical or mental issues to deal with, that's fine. But if you're looking for levels to move, to start feeling better, to lift you out of your depression, you're going to have to go for a high dose daily. And you need to not compromise on quality.
Right.
As easy as that is to say, I do try and work with patients' budgets and see which is the best quality for your budget, because it's just realistic that not everyone can afford.
Have to be practical.
Yeah, exactly. So it's your omega-3, your vitamin D, ashwagandha. Another adaptogen that I love is your rhodiola.
Okay.
So rhodiola is also a very very mood uplifting, and there's a lot of clinical research out there where it has effects on your serotonin levels to help pick it up. So rhodiola is lovely to use for depression as well as anxiety. Very often the two are linked.
Yeah.
A lot of people are anxious, and that constant state of anxiety does
because I always
also
tell my
make them
patients, how can you worry all the time and be happy? It just doesn't correlate.
Yeah. The other herb is your licorice. So your glycyrrhiza or your licorice root, that's also what we call it adrenal tonic. So it helps replenish your adrenal glands. Also, though, I must mention it's not to be used in people with high blood pressure. So hypertension, you would want to stay away from licorice. But other than that, licorice is amazing. And also sleep. Are you getting at least 6 to 7 hours of sleep every day? And most that are anxious or depressed have issues sleeping. Either you're sleeping too much or you're sleeping too little, and both are harmful to your health.
And that's interesting because we know that's one of the symptoms of depression is a change in sleep patterns.
And one of the easiest supplements to use for sleep is your magnesium. A good high dose magnesium before bed will do you a world of good. It also helps with cognitive decline and a whole host of other benefits.
I'm going to bring up vitamin D because I think it's so interesting when, somebody comes to a psychologist and we're dealing with depression or depressive symptoms. The first thing I do is behavioral activation, which is get them moving, get them to do things that brings them joy, even in the smallest form. And I always advocate exercise. Get out there, even if it's 20 minutes a day, and even if we start with 5 minutes initially, get them moving, get them walking, go out in the sun. And I'm just thinking, vitamin D is supposed to be from the sun, right?
Yes.
So will being out there give you also a source of vitamin D, or you're talking it only comes from tablets?
There
or
are
is it a combo of both?
Some patients whose vitamin D levels are so low where you have to do supplementation. And you also can't expose your skin to the sun for a really extensive amount of time because you don't want to do any damage as well. So yes, a certain amount, and they say like that midday sun, about 15 to 20 minutes of it is adequate enough daily for your vitamin D dosage. But like I was saying, if there are gut issues, and so often there are, you are not going to be able to convert that vitamin D into your D3, which is needed by your cells. So it's that conversion into its active form.
So if there's a gut issue, sitting in the sun's not going to get you.
It's not. It's just going to get you burnt. But it's still good maybe for your, just...
And I've heard this, that, the vitamin D, tell me if this is true, is absorbed from your arms and certain parts of your leg. And that's where that must be exposed. Is that true?
No, they tell you that you need a very large surface area to help get that. So just like face and hands is not going to cut it.
Right.
Like even torso, back, it doesn't matter
Which area
it is, but you need a bigger surface area for that absorption.
Okay, that's interesting. So who told me I know them? I'm going to go and catch them because I've been opening my arms and like spreading it out for the sun. But so look, I know I have to say this. We always have to give an objective stance, right? He's smiling. What are the advantages and disadvantages of homeopathic remedies?
Okay, we'll start with the advantages since that's the longest. Advantages: less side effects,
Right.
easy on children,
Mm-hmm.
pregnant women, breastfeeding women.
Yeah.
We're talking postnatal depression,
Yeah.
where so many herbs and other medications contraindicated.
Yeah.
Your elderly. So you know what, we're looking at gentle
Safe.
medicine.
Yeah.
Exactly. Safety, and safety is first, and that's what you want,
Right.
especially when you're looking at kids.
Yeah. Yeah.
Safety is key when it comes to just being on a path of, or knowing that you're not going to be on something forever. I think it's a bit consoling to a patient, where you're telling them, look, this is a short-term journey
Yeah.
that you're going to take with me, and then you're hopefully going to be well enough to manage on your own.
Okay.
Whereas when you're going to see psychologists and a psychiatrist, and then they keep just renewing your script,
Yeah.
and like, when does it end? When are
Yeah.
you, and often they sit with that label of,
The
I have
diagnosis,
anxiety,
yeah.
I have depression, and you are not that disease. That disease is part of your individual characteristics. It's part of your
part of your suffering. It's not you completely.
yeah, it's not you. Just we need to move away from the labels.
Okay. Right, I hear you. And then I'm wondering, look, I think I'm playing devil's advocate here. It works well, right?
It works extremely well.
Right. And then you said there's limited side effects.
There's limited side effects.
So what's the disadvantage?
So the disadvantages is that, I guess, it doesn't work for everyone.
Okay.
And some people are just happy to just take the hardcore ammunition,
Yeah.
but sometimes, there's a place for everything, and if that's what you need, that's what you need.
Right.
And also, I must also add that you can use the homeopathics alongside your conventional treatment.
Yeah.
So you're not doing yourself a disservice at all by adding on another therapy,
Yeah. Yeah.
if it's going to maybe help you wean off your current one.
Okay. So we've got another WhatsApp here where they're greeting you and they're saying that they want some of your details on air. I don't know, want a brief history of your life and how many years of experience you have. I don't know if you're comfortable sharing that.
Experience-wise, this is my 8th year in practice. I've lectured physiology for 4 years. I've moderated for 1 year. So you know what? I think I do have a fair amount of experience.
Yeah, yeah.
But it's so, every patient knows who they feel comfortable with.
Yeah, it's
And
a fit between the patient
yeah.
and the doctor or the therapist.
Exactly. Sometimes, it's better to have fresh eyes on a case.
Yeah.
And someone who looks at things differently, or is a bit, more into the trending research that's out there. And sometimes it's excellent to just have experience on your practitioner side. So it's completely a personal choice.
Right.
I am in Musgrave.
Yeah,
my
maybe you can just
practice.
give your email address or your website address so they can pick up the rest of the details.
Okay, my
there.
website address is www.homeopathDurban.co.za, so you can easily find me on Google. That's not a problem.
Okay.
So
I think let's just pause for a quick ad break and then we'll round up when we get back. Assalamu alaikum and welcome back to Mindful Matters with me, your host Nazia Iram Osman, and we're talking to our homeopath, Dr. Fatima Hansa. Fatima, I think we have a few minutes more, and there's one question that I have to ask you. I think we just discussed it with the dietitian last week, but I think it's so relevant. That is, what is the relationship between your gut health and mood?
I think you cannot ignore your gut with any condition.
Yeah.
Especially mental. You cannot ignore that there's something going on there. And it's your they call it your gut brain axis. You have your neurotransmitters that are made in your gut.
I read that you said it's 70% of your serotonin made in your gut.
70% of your serotonin is made in your gut, and it's manufactured by your probiotics.
Okay.
So they assist in your body making neurotransmitters. So probiotics are huge in treatment of mental as well as physical conditions. And if you're looking at anxiety and depression, don't ever think that you're doing yourself a disservice by not taking a probiotic.
Right.
For almost all my supportive treatment with any condition, I look at vitamin D and I look at a probiotic.
Okay.
It's never gonna
because I've always thought that anxiety and all of those things cause problems in the gut. Are you saying that also problems in the gut also
what happens
cause?
is they mirror each other.
Okay.
When you're anxious, your neurotransmitters are high, and then the same with your gut, your activity is high. So you're often getting your cramping or your diarrhea with anxious people, that IBS type of symptoms. 9 out of 10 times, if a person is anxious, they have gut issues. And the opposite with depression, where you have low neurotransmitters in your brain, and then you have low activity in your gut. So slow motility, constipation, and it's very rarely that they don't mirror each other.
Okay.
So you have to treat both. You cannot ignore it at all.
Sure. That's very interesting. And I think this is the second week in a row where we've actually highlighted that relationship. And, I think I have to thank you once again for coming on this Sunday, taking time away from the family. And I thank your husband in particular for the sweet message that he said, but his wife said, I cannot read it on air. She's going to kill me for this one. But thank you for that. And we have to round up today, but I will leave you with the thought of the day that was kindly provided by Fatima. And I think that's the basic premise that homeopathic treatment is based on. And it's written by Samuel Hahnemann. And it goes like this. The highest ideal of cure is the rapid, gentle, and permanent restoration of health. That is the lifting and annihilation of the disease in its entire extent in the shortest, most reliable, and least disadvantageous way, according to clearly realizable principles. So we'll see you next week, inshallah, when we have another exciting topic, and that is transformation from pain to power, when we speak to the dynamic Nazia Iram Osman, who is a body talk practitioner, about her own struggles with health, grief, and relationship, and how she has coped. This will be our special for Women's Day. Assalamu alaikum, and I hope this show lived up to its promise to inspire, educate, and motivate. And remember, be mindful, be kind, and enjoy the rest of your week. Ma salam.